Hello, and welcome to Abby Tyler's Healthy Living. My name is Abby Tyler. I'm your host, a family nurse practitioner, a health and wellness blogger, and a community volunteer. In here, we discuss evidence based health information regarding mind, body, and soul with a holistic emphasis. Thanks for joining me on this journey of health and wellness. Please enjoy the show. Good evening. Hello, hello, hello. Welcome to Abby Tyler's Healthy Living. My name is Abby Tyler. I'm just gonna give me 2 seconds here. Let me get myself together. Get my notes over here. Alrighty, how are you all today? As you can see, 1 second here. I'm just gonna open up myself. Please share the show. Give me a few minutes. I'm just trying to get my notes together here, and I'm gonna take this off the screen. Sorry. Okay. 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 So my name is Abby Tyler. Welcome. Glad to be back this week. As you can see, the topic of the show is postpartum depression, baby blues, or postpartum depression. This show is coming on as a request from one of our viewers. Also, in the future, if you guys want me to talk about anything that is within my scope of practice, I will just let me know ahead of time, and I will put it together. So yeah, we are today. Again, my disclaimer, whatever I say here should not take the place of you. I am a provider, but I'm not your provider. So please do not make any changes to your regimen without first speaking to your own provider. Okay, so we'll start. Just trying to make this a little minimized this year. Okay, and 1 second, trying to share. Okay, so yeah, we are. Okay. Congratulations. You had your beautiful baby boy, your baby girl, and everything is fine. He or she is healthy and just perfect in your eyes. Okay. And everything is going great. You had a baby safely. You have family visiting, friends visiting, and they brought all this stuff, all your things from the baby shower. The baby room is all beautifully decorated and everything is fine. So, you start going through your motions and the family and all that. And for those of you who have to go back to work or work from home and all that, or just stay at home moms, you start going through that and everybody's happy. For then after a while, because when you have a baby, when you're pregnant, all your hormones and everything are like over in overdrive. When you finally deliver the baby, your hormones have to go back to being balanced, especially if you're breastfeeding as well too. Everything has to go back in balance. And sometimes they're supposed to go back to where they're supposed to be, and sometimes they don't always balance to where they need to be. Now some women get through that and they have the baby blues, like sometimes you wake up in the morning and you just don't feel like doing anything this morning, and you take a little longer to get out of bed, taking a little longer to get to the baby, and you're having some issues with the other family or other children and all that. That's perfectly normal. Okay, let me just look in here and see. Okay, that's perfectly normal, and it's called baby blues. People go through that. You had, like, again, like I said, your hormones and everything going back to where it needs to be, and called the baby blues. Okay, so let me just go in here and see. So you said, well, what's the difference between the baby blues and postpartum depression? Okay. So I'm going to be. So some of the symptoms of baby blues include moodiness. Like it can be like, oh my god, somebody's got a little attitude today. What's going on with her? How come you don't feel like it? I mean, aren't you happy that you had a baby? The baby's fine. What do you have to be mad about? And especially when it comes to our cultural things too, where if you come from a culture where you have the baby now, and if you're religious and all, they'll tell you, oh, make sure, what are you so sad about? God bless you. You had this baby, and what are you doing? And especially some people who have like mysterious thing that, oh, witchcraft, how come you doing this? So, moodiness, crying spells. Sometimes you just cry for no reason. Even when you were pregnant, you were crying for no reason. Not crying for no reason, it's your hormones and all that. Irritability, you just don't want to be bothered, and the baby's crying, is making you a little bit mad. So yeah, all those things are pretty normal. Fatigue, because after all, you had this baby. If you're breastfeeding or if you have other children, of course you got to eat enough, so you don't have enough energy, so that all comes along with just normal baby blues. So sometimes you're sad, sometimes you're happy. Again, like I said, moodiness, crying spells. Worry about whether you're being a good mother, especially when you read all these magazines and you're under so much pressure to oh, you're supposed to do this, you're supposed to sleep when the baby's sleeping, and you're supposed to be happy. And now, and we live in a world of social media where you have to go take your photo shoot and be the best mother you ever be. And sometimes maybe you had children before, and you tell yourself, okay, this time around it's going to be so much better. Or if you came from a home where you didn't think your mother was that great, or whoever took care of you was that great, you're going to be the best mother. So you constantly thinking all those things. Did the baby get to eat on time? Did I, was the temperature just right? Did I do this right? Did I buy the best music for the baby to listen to? Did I buy all these inspirational things for the baby to listen to? So when the baby grows up, he or she can be like this bright Einstein person. So you're doing all that, okay? And you then sometimes you're having difficulty sleeping too, because again, like I said, they tell you sleep when the baby's sleeping, wake up when the baby's awake, clean up, and do all this, and you running on empty after a while, and you find yourself going through that. So it's okay. Most of those things and all that, they kind of dissipate. They kind of resolve over 1 to 2 to 3 weeks when you're a little when everything has calmed down and you say, okay, now I have a routine. I know when I'm supposed to get the baby ready. I know when I'm supposed to get the other kids ready. And doing, especially for first time mothers too, this can be even more difficult for first time mothers, because sometimes the first and second child, okay, you're like, okay, I kind of get this down. I kind of have a routine. But the first time mother, you're pretty much just going through the motions and dealing with that. So usually within 2 to 3 weeks, it kind of dissipate or kind of resolves a little bit, and you can get back and you find yourself getting back to where you need to be. But for some people that goes beyond that point, and when it starts going beyond that point, that's when we start calling it postpartum depression. And most times, you people don't want to say, don't want to talk about it, because you don't want to feel that, oh, people are going to judge me, I'm not this great person, I'm not this person that, I don't. Some people, simply because you have a baby doesn't mean you have a maternal instinct. People might say, oh, I can't believe she did this, and she did this to her child, and she did this, and or she doesn't seem like the kind of person who want to be home, and she just wants to be in the street, even though she's a mother. Not everybody has that maternal instinct that just comes automatically. Okay, again, like I said, all these symptoms that I listed before, they're not conclusive anyway. So just in case, if you say, well, I'm not having those symptoms, you could be having something different. But those are the major symptoms that we talk about. So when you say, okay, what is postpartum depression? Postpartum depression is like usually when it goes longer than that. It shouldn't last for anything 2 to 3 weeks. Like they always say, if you wear your robe in the morning and you don't want to get up, you say, okay, I'll just keep my robe on and then get up and go fix the baby food or go do this. That's fine. When you have your robe on and you say, I don't want to get out of this bed, and this baby's crying and everybody's doing this, and your husband or your partner or your boyfriend, girlfriend, your whoever's going on, and nothing seems to be moving you, that's when we start saying, okay, this is something more going on than just the baby blues. Okay. And it's like, it can be confusing with baby, but like I said, it goes on after 2 to 3 weeks. All right, so let me just get over here. Postpartum depression that occurs after childbirth. Is a type of perinatal mood disorder. Most of the time, the depression starts before you even have the baby. Yes, when you have the baby, there's that big hormonal drop, but also when you're pregnant, you start getting a little. Some people get a little depressed too. I did my paper about that, and even when I was doing my clinical, I had a couple of other patients that came in, and you could tell that they were depressed. They were talking about different things. So it's very important that when you go to your doctor, you having these symptoms. If you're pregnant, when you're pregnant, please bring them up to your OBGYN. And if you're also going to see your primary care provider, please bring them up too, so they can start treating you long before time. All right. So it starts during pregnancy within, and it also continues within a year. So it can last almost a whole year, and especially if it's not addressed. All right. So what you said, what are the signs of postpartum depression? So let me just get in here. So some of the signs of having postpartum depression. Let me see. Okay. So common symptoms, and again, like I said, not everybody will get these symptoms. So feelings of sadness and emptiness, okay, that's going way past. These are things that are good, getting really deeper and going past the 2 to 3 weeks of the baby blues. Loss of pleasure in activities you normally used to enjoy. Of course, you're not going to be doing the same activities you were doing before, because now you have this baby, so you have to be paying attention to something else. Sleeping too much or sleeping too little, trouble falling asleep or staying asleep, feeling of sluggish or lethargic, the same thing, being sleepy, and you're like, I just don't know, I just don't have any means to get up today. I don't know what's going on with me, but it's just not, I'm not there. Okay. And then what's he saying, you're hiding it from your friends too, but you're feeling it, and it feels like you're alone. And this is really common, by the way. So don't feel like you're alone when if this is going on with you. Speak to somebody. Loss of appetite or rapid weight gain, or rapid weight loss. That's also, especially if you're breastfeeding, you should be losing weight that much and you shouldn't be gaining that much weight, because the chances are more than likely you're not eating something healthy. You're just eating just to sustain yourself, or you're eating because you're depressed. So you're just taking in more food than you're supposed to be. Okay, not feeling bonded to your baby. Again, that can be very scary if you have this baby and this innocent being that you brought into this world, but you just don't have, and you don't have any. You take care of the baby, you're making sure he or she is fine, but you just don't have any connection to this baby. You don't feel it here. You don't feel it here. It's like, okay, like this baby is like total stranger to you, and your body is not reaching for it. Your mind, you don't feel anything about this baby. Okay. Again, like I said, with cultural things in certain places, people start saying, oh, maybe you did something. That's why God's punishing you, or you did something, or this something is wrong with this baby. This baby's witchcraft, or your witchcraft. Oh, yeah, we're talking about cultural things and different things, and other in different cultures, it can be translated differently. Okay. So difficulty concentrating, you can say, okay, you got mommy brain, but if it's really difficult, like you really cannot find yourself doing the things that you're supposed to be doing and thinking anything through, you go to the store and you totally forgetting what you're supposed to get, or sometimes you have to go back to work and people start noticing that you're having some problems at work. Okay, you can't think clearly. You're very indecisive about things. You can't make up your mind what it is that you want. I want to eat this, and then you start crying. I don't want to eat that. I want to go out. I don't want to do this. Feelings of excess guilt or worthlessness. Okay, why am I feeling this way, and why you feel you already have the feeling, all of that, and then you're feeling like, oh my god, there's something must be really wrong with me, and why am I feeling guilty that other people out there who have been trying so hard to have a baby for so many years. There's so many people who are having miscarriages. Some people, I mean, people love to get pregnant and have this baby. Yeah, I have this baby, and I'm all this is going on at the same time. You're like, I don't feel like, and I just feel worthless. I something about this that's not going on, that I really, something's going on that I can't put my finger on. Okay, and thoughts of death, suicide, or harming yourself or the baby. That's why usually when we have patients come to the office, I see pregnant patients when they come for their primary care, but at the same time also taking care of pregnant patients. So I also have to discuss these things with them too. So I usually say, how's the pregnancy going on? We'll talk about anything that may be because if you have anxiety and depression and other mental health disorders. Again, when people say mental health, we don't mean crazy people. Like, we always try to put everything together, but anything can range from, like, situational depression, anxiety, to like way to the other side there. So if you already have these issues going on, I always bring it up too. So you taking your medicine, again, if it's safe with your OBGYN, are you taking the medications you were supposed to be taking for your anxiety or depression, and while you're pregnant, if it's safe, again, like I said, check with your provider, and also, and what's going on. So we have a little talk and all, because as a primary care provider, I'm also responsible for making sure this patient is going to have a safe pregnancy. Okay. So, and we actually, and in suicidal ideations and in homicidal ideations. And also we'll go back to the point that if you're, before you get pregnant, these things happen, while you're pregnant. And I also ask some women when they come in too, I'm like, okay, are you on any birth control? They might say, no, I don't have any birth control. Okay. Are you sexually active? Yes, I'm sexually active. I may be using barrier method, or do using something that, like I said, the pull-out method, that's so unsafe. So, okay, then think about it. Are you ready to get pregnant if you get pregnant? Okay, then that's when we have to sit down and have that talk and say, you have to make sure that if you're going to get pregnant, and these are the options out there. I'm not getting into another conversation with no abortion and all that. So please don't need any comments about that. We have to talk about everything. Say, if you're doing all these things, like, you're not ready to get pregnant, you're not safe to get pregnant yet, I suggest that we talk about contraception methods. I know, and there's so many options out there, where sometimes some people cannot tolerate certain methods, and some people have medical issues, that they cannot be on birth control. So it's very important. And I said, okay, then you need to talk to your GYN, because if you do get pregnant, then you have to sit there and talk to your GYN what your options are. Okay, because this is something where we want to make sure that if you do get pregnant, that you're not going to harm yourself or harm your baby. Okay. So these, yeah, some of the things that, like, the warning signs to watch out for. Okay, so your baby blues have not gotten better. It's common to have a little dip in your mood the first 2 weeks, but like I say, it hasn't gotten better. But if you're still sad and hopeless week later, and the feelings are growing intense, and it's more than the baby blues. Okay, sadness or guilt consuming, I went through all that. You lose interest in the things you used to enjoy before. You have trouble making decision, again, like I said, being indecisive. So you go back here, and some people, if you also have, like, again, going back to anxiety and depression, if you have history of that, of course, that makes it exacerbate the situation, but not always the case. Okay, so let me see some of the causes of postpartum depression. There's so many other reasons and all that too, and some of it scientists haven't found it out yet. But some of the common causes that has been found out. So genetics play a major role too. So women with personal family history of perinatal mood disorders are at elevated risk for developing that. Okay, meaning that if your mother, grandparents, and all that, grandmother or other female members in your family that had issues, that's why it's important to talk to your family member when you're going through these things or prior to getting pregnant. When you got pregnant, mom, what went on? Did you have these issues? And I mean, Gen X, of course, Gen X and Boomer people don't talk about anything to anybody. We don't talk about medical history. We don't talk about that. And depending on the culture you come from, and your mother could be ashamed too, because maybe she went through this and she just never told anybody, or it's just something that if she tells you, yes, I was depressed when I had you, or I had this issue, you're gonna feel bad. You're gonna say, oh my God, because of my birth, it's why my mother felt this way, or she was going through this and nobody was there to help her because of my birth. That can make you, and some people say, yeah, I was going through this and I prayed away, or I was just so happy to have a baby. I didn't let it bother me. But they have, then again, I display risk factors because they went through that. Okay, so family history of mood disorders, especially doing that, I said that. Prior episodes of clinical depression. Again, if you have episode of clinical depression, sometimes the first, second, third baby, all you can have it all through. Okay, anxiety, depression during pregnancy, again, during the period of pregnancy, stress for marriage or relationship or anything experiencing like domestic violence. Of course, domestic violence and abuse, again, if you going through any kind of pregnancy, always, if you go into pregnancy and all, people say, okay, yeah, domestic violence, he's not going to beat me if I get pregnant, or he's not going to do this, that, get pregnant, that chances of you getting killed or getting severely injured during pregnancy during this time is when you get pregnant. Okay, because the man knows that you're like very vulnerable and you're trying to protect yourself and to protect this unborn child, and also if you have younger children at home. So most women just kind of give into that, and try not to escape, because they know that if they come back, it could be very deadly for them. Okay, I talked about the story about my cousin before. All right. Lack of support from family and friends. Some people, don't have too many friends prior to getting pregnant, and they see other people. You see all these revealing thing where people have these huge people around, whole group around, and they're having this huge baby reveal. Some people just don't have friends like that. And sometimes if you live in a state, or you live in somewhere, a city where your family member, your closest family member, are only available to you by phone, so you don't have people there who can say, oh, let me take you to the doctor's appointment today, or let me take the baby, let me take the other kid, so you can go to the doctor's appointment, you can get your hair done, you can get your nails done, or just do something to make you feel good. You don't have that kind of support. So all of that kind of makes the depression, even worse. All right. Difficult, the baby, sometimes the baby, you're like, oh yeah, I'm gonna have this beautiful baby, and they're gonna be so perfect, and they're gonna sleep when they're supposed to sleep, even though they're gonna wake up, but everything is gonna be fine. But some babies are just really the temperament of the baby, and it's like it makes you cry all the time, because this baby, I had some relatives where they would just cry and cry and cry, and you sing 10,000 songs to them and it's still cry. It's like, oh my God, just let me just rest a little bit. Could you just, and sometimes it's like, okay, just put the baby with it and go for a walk. Okay, because when you're sitting there and trying to shake this baby for this baby to stop crying, that can become very, very dangerous. Okay, so that can also exacerbate the depression as well. Recent stressful life events such as divorce. Some people are going through divorce when they're pregnant. They got into a relationship and they got pregnant, and the husband somewhere else, or the boyfriend somewhere else, or whatever it is. The husband may have died. You may have lost your job because you got pregnant, or something happened and you got laid off from your job. Your husband got laid off from the job. All of that can make the situation worse. All right, separation, again, like I said, people get separated there many times a year. Oh yeah, I was pregnant, and people deliver, and the father's nowhere to be around, or whatever happens, or he's away. Maybe he's away in the army, or he's away doing some service, or overseas doing something else that can make the situation worse, because you're there all alone. Even though sometimes some people have a lot of friends, but they still feel very all alone when they have this baby. All right, stress of childcare. Everybody knows how expensive childcare can be. I remember when my kids were in school, which was like daycare, which was like a million years ago. It was $145, $150 a week, and some people cannot afford that, especially if you're not getting any kind of help from the government. It can be very expensive. And so that you're talking about changing your hours of school, changing your hours at work. Sometimes you go to work and go to school. When I had my daughter, I was finishing up my college, my first when I was in doing my associate degree, and it was like my husband, who's going to stay home today, or we had to change our schedule around when you have babysitters and all, and it's like the babysitter's not available, so you have to call out. All of that, all those things that women have to deal with, and also, men too, because men go through it, but most of the time it's like the woman is the one that's like doing the majority of that. Okay. Stress of childcare, financial strain, like again, like I said, your loss of your job, traumatic birth, whatever your delivery was very traumatic. Okay, sometimes you go in there and so people are like, oh yeah, I just went in there and I pushed and like 2 times and oh, the baby came right out. Oh, as soon as I got to the hospital, baby came right out. Some people are in labor for 24 to 40 hours, 36 hours. They have to do the epidural. And then sometimes you have the baby and you have a little bit of tear, the vaginal area tears up a little bit and they have to sew you back up. It's called a episiotomy. And depending on the degree of tear and all that can really be painful in order to heal, and get back to where you need to be. So you're having this like severe pain down there because the baby go either too big and they had to open you up a little bit. Because sometimes, I mean, I don't want to go too much into detail, but it's like a tear, open right there, and they have to sew it back up. And sometimes they have to cut it too because the baby cannot come out safely out of the birth canal without doing that. So you're sitting there and people smiling and you just happy, but you're there and your crotch is on fire. There's no other way to say I'm sorry. So you're going through all that, and this baby's crying, and you're going through everything else, and you have other children, everything you have to deal with. Okay, and again, going back to cultural thing, there are some people always will make you guilty too, saying why are you feeling this way? You should be happy you have a baby, but you have real life medical thing that you're going through. Okay, and also being single too, because sometimes again, like I said, separation, and you're single, and you have this baby. There's some people who have the baby who want to be single and all that too. They say, okay, yes, I'm going to have the baby. I'm okay with it. I know I'm going to be single. We have this celebrity who's got, they keep announcing. I don't know why they keep announcing how many children he has. Or I mean, children every time a new birth. Of course, they got money. And I don't get mad at those women because they know what they're on. But if you're single and going through all that, imagine you in a 2-parent household and you dealing with the stress that come along with it. And then also it's like you get to a point where if you had like C-section and that C-section is not healing too well, you're taking pain medicine, but you can't take too much pain medicine because if you're breastfeeding, some of the medicine go through the breast milk, so you can't really take too much. So all of that are you dealing with breastfeeding, and sometimes so much pressure they put on you to know how to breastfeed. I remember it's like, my children like never latched on that much. And I was like, oh my God, I'm going to do this and I'm going to breastfeed and I'm going to do this. And they tell you to, less ear infection, that's the breast milk is best. But not everybody able to like, pour out so much milk. And if you have to go back to work, I remember I had to go back to work when the second time, I was in school, my daughter, but the second time when I had to go back to school, we were sitting there, I was with one of the doctor in the patient's room and we had to put like an IV access in this patient. And I'm standing there and I'm like, oh my goodness, I'm going to start leaking through my uniform if this doesn't happen. And I'm in so much pain. I'm like, I can't do this. I can't, he has to use so. And he wasn't latching on that much anyway. So we're doing the formula. I felt guilty, and it would make you feel guilty. I mean, this company, I don't want to call the name, the one that does the whole breast milk. And you watch YouTube, and I didn't have YouTube at the time. I'm really dating myself. So it's like they make you feel so guilty. Oh no, you just do this and you just like them suck on one side and suck on the other side, and you're like, it's not happening. For some women, it just happens so magically. For some, it's not happening. It's not happening. Don't feel guilty about that. Not every baby will latch on, and the baby has to eat because they tell you the baby has to, wet the diaper at least 8 to 10 diapers a day, and you sit in there and 1 to 2 diapers is still dry. You're not going to starve your child just to prove a point, right? And don't feel guilty about that. I'm not talking about places where formula is not readily available and you absolutely have to do that. You have no other choice, but sometimes you have no other choice, and then mother becomes malnourished because you have to go through this. All right. And unplanned or unwanted pregnancy, that can really, really, really exacerbate the situation because, again, going back to, did you really want to have this baby? And that's why I say if you get pregnant, you have to probably go to therapy, reconcile everything before you say, okay, yes, I want to have this baby, get the help that you need, talk to people and all before having this baby, because you don't want to bring this baby into the world and then something happens and you not have no attachment to this baby. Okay. So it's important that you do that. So how this we talk about how this is diagnosed. Let me just see here first before I go. I don't want to make this too long, but it's a very sensitive topic. Okay, so let me just look at some questions, some comments here. Okay, so I'll go back down here. Let me just pick one. Oh, for one person. Okay, Dave John said, great topic. Is there a name for baby blues in the Liberian culture? Does it go away after some time, or is there remain? Well, Dave, I'm sorry, I don't know if you came on before. Baby blue, I don't know baby blues in Liberian culture. I guess you have to check that out. Maybe your brother knows because he knows everything. But I don't know. But I it goes away. Baby blues, like I said, it's like 1 to 2 weeks, and it goes away when it stays longer than that. That's when it goes into postpartum depression. Alrighty, so let me see. Bertha said we are here, Abby. Thanks for your contribution. Thank you very much. Yes, let me see here. Um, Queen said, thanks for your awareness of health information to our people. Thank you very much. Let me see what Jackie Jackson said. This is a important topic, especially despite the age differences. Yes, it is. Yes, it is. And I mean, for some of us who went through certain things that we didn't have, there was nobody to talk to, and we didn't have the resources like the internet and everything available at the time. So it's very important. And denial, pride gets in the way. And I mean, that too, denial, you want to, but it's like like again, like I said, it makes you feel guilty. People will make you feel guilty that, you were able to have this baby, and there's so many women out there who can have any babies, and they're having so many miscarriages. Why are you so upset? Okay. So, and what's going on? Just, pray it away, pray it away, pray it away. Yes, you can pray. Prayer is also part of therapy and all, but you need to get help. Okay. So, the American College of Obstetrician and Gynecologists recommends that, obstetrician screen everybody during the pregnancy, and also like the first you see your OBGYN after like 6 weeks. And sometimes if you need to see them again, let's say if you had like C-section, you need to remove the staples or the sutures, or they have to look at your vaginal area to make sure if you had an episiotomy, if everything is healing up nicely down there. And sometimes they may have to go back there and fix it back up again. So they're supposed to be asking you these questions. You're supposed to be filling up these forms. It's called a PHQ-9. I did that before. I'm going to put that underneath there. This will be asking you, like how long are you feeling sad? How many days of the week are you feeling sad? Do you feel all this? The whole questionnaire is supposed to ask you that. And also we do that for anxiety and other reasons too, anxiety, depression. So they're supposed to do that. But most women, when they go see their doctors and the GYN and OB, they're like happy. Everybody's there. They're, oh, the baby is happy. The baby's happy. And you don't want to talk about that. You don't feel like you need to be talking about that. You feel like I'm a woman. This is what people go. This is what people go through. And if I'm feeling this way, eventually it's gonna go away, and I'm just gonna smile and go through it. If it's bothering you so much that it's getting to you all the time and it's going on, it's affecting your life, of course you don't want to do this. You want to make sure you're talking, and your doctor's supposed to be bringing it up. If your doctor doesn't bring it up, bring it up. If it means that you need to make an appointment and say, I'm coming in for my 6 weeks visit, but I need to see them again. I need to see them for this. Make sure you go in there and let them know that you're going in for that. Because if you go in there for your 6 weeks visit, they do all the medical part they're supposed to do. They talk to you for a little bit, and 15 minutes, you're out. 15, 20 minutes, you're out. So you don't want to sit there, because usually we, again, as in primary care, we have this special amount of time that was supposed to be in the room based on the diagnosis and all that. So if you go in there, say, okay, yes, everything else is fine with me, but I need to check this. And at the same time, you will be going back to your primary care provider too. So usually that's when I come in and I also ask the question. Also, we're supposed to bring that up. You usually had a baby. How's the breastfeeding going? Are you feeling safe at home? How everything breastfeeding going okay? Your surgical scars or anything else? Everything else well. So I'm supposed to be asking those questions as well, all within like the 1 year period too. Okay, so they're gonna, ask you those questions. I don't want to go too much into the detail, but when they ask you those questions, and then based on what your answers will be and how severe the symptoms are, then they can determine what the treatment will be. Okay. So if you get to the point where there's two different kind of postpartum depression, by the way. So let me just get there. So there's depression with anxiety. Okay, this is the one where accompanied by major uptick in anxiety. About 2/3 of women go through this. They worry about, again, as they interfere with your ability to function normally, to fall asleep, to stay asleep, and you can do that without getting too severely depressed. So that's the one kind of anxiety where you're really worried all the time. The one that's very, 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 very scary, and if you don't hear anything I say to this, please listen to this. That's the postpartum psychosis, and that's the one where it's like off the really deep end. Okay, really deep end. I think there was this lady in Texas a couple of years ago. I think over maybe 10 years now, 10, 15 years, where she had about 7 children, 5 to 7 children, and she had issues with anxiety, depression, and other psychosis and all. And they were very religious from the press report. They were very religious and they just kept having children, kept having children. And sadly, I mean, I'm not saying that anybody's going to do this, but it's like this is where it could get to that. Okay. And because of, again, like I said, because she had other issues prior to that. So one day the husband went to work, and what did she do? She took all the kids, put them in, they were like thinking from newborn, maybe 3 months to about 10 or 11 years old, brought them all into the bathroom, and she literally killed all of them. Okay, so that's how bad it can be. So if you have issues with anxiety, depression, and any other mental health issues before that, even sometimes you have nothing, but you have other reasons, please talk to your doctor, and please speak to your partner, your boyfriend, girlfriend, or what your the other person who got you pregnant, whatever it is. And make sure you have those conversations and saying, these are the things that I'm dealing with. If we're going to have children, let's talk about it. Be very adult about it, and don't be ashamed to bring it up. Okay. So, but this is very, very rare, by the way. So if it gets to that point, that's when you really, really need to get help. Okay. So women with postpartum with psychosis, that's severe insomnia, meaning that you're not getting any sleep. So, if you're not getting any sleep, your body's not resting to recover, and your body needs to rest to recover. So your heart and lungs and everything slow down, your brain slows down. You're supposed to get enough sleep, let your body rest and recover. If you're not getting that, you know how really angry and ornery some people can get if they don't get enough sleep. So now imagine going through 2 to 3 days that you're not getting any sleep at all. Okay. And the baby's crying, and the noise, and the work, and the family, and family members you may not agree with, and everything is just, I mean, it's like maximized, so to the point where it becomes very, very unsafe. And some women can be going through that and nobody would know, and their brains like out of the nowhere, and it's just like nobody knows that. And sometimes they keep it quiet, or they just, and some people start noticing. So if you're in this relationship with this person, or your family member within this, know this person, friends and all that, please, if you start noticing this, try to get them the help that they need. Okay, speak to, again, of course, you can have seeking intervention. Other family members can say, okay, you need to get help, because it's getting scary. All right. Confusion, things where, I mean, things that were clear to them before, because you're not getting enough sleep. So confusion, excess energy, excess agitation, you just start having delusions, you start believing things that are not okay. You start thinking, okay, this person who was here with me, they're probably sleeping with my husband, this person is trying to kill my children, this person trying to take my people talking to me, and they're trying to do something, and especially when somebody says it's getting unsafe, and you start thinking, you start isolating yourself, because that's what they do. They isolate themselves, because after a while it's like everybody coming at you like this, and you feeling like, okay, I need to protect myself. So naturally you're going to run to protect yourself. So you start doing all those things, hallucinations, you start, seeing things that don't exist. And the person who was closest to you at the time, you start pushing them away. It could be your husband, it could be your mother, everybody, everything started looking really suspicious to you. Sometimes even the baby, you start thinking the baby is possessed, because especially again, if this baby is crying so much, or the baby's not even doing anything, and you start thinking, okay, there's something going on. There's something going on that I need to get out of here. And some women like, little, just take the baby and just walk out, or just leave the baby there, and they need to get out and leave the baby there, or go somewhere, leave the baby in the car and go somewhere. Don't pick up the kids or do something. So at this point, if you know this is going on, if it's this your wife, if it's your girlfriend, or a close family member, please, whatever you do, if it means call 911, go ahead and call. Let him or her be mad at you. Don't sit back and say, oh my goodness, if I only call somebody, okay, if I only call somebody, these kids will be here today. If I only call somebody, this whole family will not be dead today, or it's going through something else, okay? It's not, I'm not saying it may get to that point, but when you go from depression to psychosis, that when it gets really dangerous. So you want to start taking care of it long before you get to that point. Okay. And again, if you had pre-existing issues with mental health, that makes it worse. Okay. So, and paranoia, extreme suspicious level of, like I just said, people around you. Okay, so people with psychosis are higher risk of harming themselves or their children. It's a medical emergency requiring immediate medical attention. So if you suspect anyone, again, like if you suspect anyone doing this, make sure you call 911 and get them the help. Even if you're somebody at the person's job, you sometimes see, I mean, you can see if you're working with them too, you see that they start acting differently. If they come, some of you will be seeing this during the Christmas holiday or holiday stuff. You'll be seeing some things that's different. Oh, you had the baby. So what's going on? Ask questions. Don't be nosy. And, don't ask you if you're just going to say things that, oh, yeah, maybe this is going on. Make sure you're asking in good faith. Okay. And that person may not open up to you, but if they open up to you, please do not shame them. Please do not shame them. I know sometimes in our culture, we do certain things that we still have to work with. Please do not do that. If the person say, this is what I'm going through, I can't bond with this baby. I can't. I've done everything. I can't. I can't. I love her. I do everything that I'm supposed to do for them, but I don't feel it. Not every woman's going to develop that maternal instinct, even though you went through 9 months of pregnancy. Not, and like I say, the person, and they're going through that. Okay, so please do not shame them. Just be kind and try to say, okay, did you talk to your OBGYN? Did you talk to your PCP? Because we have so many resources out there. Okay, if there's any suicidal stuff, call 911. 911 suicidal, I always ask my patient, any suicidal, homicidal ideations. I know you don't want this person to be taken away, or the person's not going to be put in jail or whatever. They just need to get some help. Okay, so some of the treatments that we talk about, all right, is, it's all postpartum depression. It can be, it's like a horrible thing, but it can be controlled, and and you can get the help that you need in order to have have a healthy baby, have a healthy family, and have a healthy life. So some of the therapies, some of the way it's treated. Hold on one second. Let me just go in here. So therapy, I got a psychologist out there. So usually I would send my patients to refer them to psychology, but as you all know, we're at mental health providers, therapy, psychologists, and psychiatrists. They're not readily available, and depending on the area that you live in, you could be waiting 2 to 3 months to see a therapist and all that. So guess who takes care of these people? Primary care provider. We're the ones who the psychologist won't be prescribing medication. The psychiatrist will, and the primary care provider is the one. Also, we have prescriptive authority, so we're going to be prescribing those medications, and we're going to be doing that because if the patient says, "Oh, I didn't get the chance to go see my therapist," we have to do that because, of course, we're bound by law to do that. So the call counseling, talk therapy, where they go in there and talk to you about it, talk about your behaviors, develop different ways of coping mechanism, building positive outlook, and going through evidence-based therapy. They go through also cognitive behavior therapy, all of that. I don't want to go into details so into that. And also, if it gets to the point, they'll also refer you to social worker, put you to social groups, and all those different things. And then, like I said, after you pass my point, we're working along with the therapist too. So if sometimes they call me and say, okay, yeah, you may benefit. I think where you are right now, you may benefit a little bit of from some medication just to help you out. Doesn't mean when they say that, you need some medication to help you out, doesn't mean that what you're doing has failed or you're just bad, that you need medication to take care of your baby, to take care of yourself. And some people feel ashamed. And of course, the mental health stigma that goes around. Oh, this one's crazy. That one, you hear about mental health, anything going on, you hear people who kill somebody, kill them. Right away, people think, oh my God, I'm not that crazy. I don't need all that. You may need it. Okay, so after meeting with the therapist, they might say, you just take that for a little while. It may help you along the way. And then as a point, like I said, situational depression, situational anxiety, and psychosis, you may need a medication for a short time. And then, you may not need it anymore because you're going to continue taking the medication and also going to therapy. The medication is not magic. We're not just going to be giving the medicine and everything's going to go away. And sometimes people don't, respond to certain medications. So we have to change it around. But you're going to continue going to therapists and also seeing a psychiatrist if you need to. Okay. So again, like I said, we put an antidepressant. The antidepressant doesn't kick in right away. So usually if I'm prescribing that medication for you, I need to see you at least every 2 weeks. And then also every like 6 weeks until we start going every 3 months and all that. So there are times that you're not going to be able to come to see me. There are times where you won't be able to go see the therapist either. So a lot of them can be online, or you say, okay, let's space it in a way where my kids go to school or go to work or go to school, and then I can make it to come to see you. So hopefully, again, like I said, when I talked about politics and all those different things, it's always good to talk, vote for people who are going to make sure that we're talking about, abortion. These are the things you want to do for women when the baby is here. Okay, it's not just the baby in the womb. When the baby's here, these are the things you want to do. So you want to make sure that that politician is working hard to make sure you get adequate child care, adequate time off from work, adequate time for mental health without losing your job. Okay. So you can, like, again, you go on antidepressant, you take some medication, and also if it's safe, of course, we've got to make sure that the OBGYN is saying it's safe. Your pediatrician, going back to diagnosis, also, the pediatrician is also supposed to be asking you those questions all until like 1 year into it. They're not just, you go see the baby, they're talking about the baby, making sure the baby's fine and all, but they're supposed to be asking you too, because you're kind of like indirectly and directly are a patient of theirs, even though you're not really their patient. But of course, whatever you do affects their patient, who is your child. So they're supposed to be asking you all those things too. All right. So alternative therapies. You can go to you can get massage. You can, it's not so much alternative, but you can also include them into the fact that, okay, maybe with the medication, and you also see your therapist, and also you can incorporate some massage, some yoga, acupuncture, also go into exercise too. That makes you feel good. I just started my exercise thing, and I'm like, oh, every day I have to go down at least 3 to 4 days, because I know if I stop, I'm not going to go back again for a long while. So exercising, opens up your pores and release all your happy hormones, and you feel good. So even if you're just watching it on TV, you turn on YouTube on your TV or on your computer, and just, even it's like 15 to 20 minutes. It doesn't have to be something monumental. So just something just to make sure you keep you happy, keep you healthy, and losing the baby weight and getting yourself together. And some people have a hard time losing the baby weight. They have a hard time losing the baby weight. And men and family, friends, and all that, please, 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 please. Sometimes even the postpartum depression can come with just the things people say. I remember, oh my God, I remember when I had my first child, and I used to wear this outfit, and I think I put it back on maybe a couple of months later. I thought I looked okay. And the first thing this person said, I remember on that outfit used to look real skinny on you. And it did just crush my soul. Of course, I was a young person at the time. Even when you're, my age, which is like, again, I'm Generation X. So it's like, you still feel bad when people say something about you. As you get older, you know how to handle it. And also, I'm really shady too. So I'm Scorpio. Sorry. But you get to the point where you're able to handle it, and but it's stuff. So mothers, especially Liberian people. Now, I'm not trying to pick on us, but I have to like single it to the people that I know, that would say things. Mm. Okay, so just watch how you say things. Okay, people say, "Oh yeah, you're too sensitive. You're so this." Yes, they just had a baby. The hormones are all over the place. And you say, "Well, you've been a whole month since you've been a whole year since you had that baby. You're so fat like that, and you're so this." And like grandpa will tell you you're fat, and they won't just make it. They'll just come right out and tell you. So please, 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 you don't know what this person going through. Okay, it's really hard being pregnant. It's really hard having a baby and going through all that and having to go back to work, and the clothes can't fit you anymore, and you have to deal with all that. So please be sensitive when you say things like that to people. They may not respond to you. They may not say anything. They may just smile, but you don't know how many times they're dying inside when you say that. Okay, please be sensitive to that. So what are some of the ways that you can cope with this? Okay. So, in addition to if you had to take medication, or you had to go to a therapist, or maybe you just need to just cope, and you say, okay, maybe I don't need all of that, but I can take care of it myself. But I just are some of the ways. But make sure you're incorporating everything into it, especially if it's absolutely necessary. Try to incorporate everything into it to make sure you stay safe. Okay. So if somebody offers you help, say, let me just take the baby, and so you can run to the store and do this. Please don't say, oh, no, don't be superwoman. You're not. You're not. I know this thing where, oh, I'm a strong woman and I can do this and I can do that. And don't be, if somebody offers to help you, if that person's safe, of course, you don't want to just leave your children and your baby around with just anybody. You want to make sure you can trust that person. So if they've offered to help you, take the help. Okay. Get support from your friends and family. Sometimes, you may have children where your children are older, and maybe one of the teenagers from the other person's, your friend can come and help the baby. And sometimes you have to, hang out with people who have younger children like you, because let's say you had a child that's very young, and your other person has somebody, the older child, they may not want to hang out with you. They may not want to be doing certain things, and you'll feel bad because you were friends with this person before, but you just have babies different time in your lives. Or you have this person 10 or 15 years younger than you, but even though you're friends, you have different age groups. And also you can say, you know what, like I have a friend who, her daughter's much younger than mine. My children much younger than my children. So it's like, okay, if we're going to go out, I know she may need a babysitter. I'm like, come over to my house. We'll sit there and talk. It doesn't have to. We don't have to go out. We can sit in my house and sit there and talk. Go to the park so the child can run around. So it doesn't have to be something proper that we have to go through. So work along with people who are very understanding that I have a young child, or I have another child, and I need to have friends who can understand that. Okay, so asking someone to watch the baby, like I said, sometimes you just need somebody to come over so you can sleep. Maybe like just watch them so I can sleep, please, or your husband, or your mother, or your friend, and all that. And husbands or partners, please be understanding of this. Okay, I understand most companies don't give men time off; they only give them like 1 week, which is so unfair. Okay, so make sure that you understand that if it means for you to change your work hours, I understand that we all have to work in this country. So just do as much as you can to just work around it. If you love each other and you love this child, if you both have to go to marriage counseling, please go to marriage counseling too, because during this time it can make the relationship so, I mean, so difficult that sometimes people end up breaking up because of that. And don't feel bad, because okay, sometimes you may have to stay apart for a little bit, right? Trying to get as much sleep as you can. Like again, I can say, if you don't sleep, if your body doesn't rest and recover, you're not going to have fresh living cells to work with the next day. And if you're too sleepy, you're going to be irritated. Okay, taking time out each day to engage, however, briefly in activities that you enjoy, dancing. Sometimes you don't, I mean, just dancing or singing, chatting with a friend. And sometimes you're talking to a family member or somebody, don't just get on the phone, put them on video phone. They may say, oh my goodness, did you do anything with your hair today? Did you do it? You'd be like, you know what, just let's just talk. And if that person is really your friend and love you and care about you, they're not going to care what you look like. They might say, okay, listen, when you're done, let's go over and go hang out somewhere and have some good time. Go on Facebook, laugh at some stuff. I usually go on TikTok and watch some funny videos on Facebook and just find things that's going to make you really happy. Okay. And make you just take away, even if it's for 15 to 20 minutes. You still have the children, you still have the baby, you still have all of that to deal with. So, and then also going back to the fact that, okay, then my husband may be like, okay, the doctor did say after 6 weeks, it's time to start. You may not want to do it. You may not want to do it and be like, yes, I know it's been 6 weeks. I know it's been 7 weeks. I know it's been 2 months. It's been 3 months. Who wants to do it when they're feeling like that? So, husbands, and there's so many other ways you can do these things where it doesn't have to be like, because again, like I said, if you have surgical issues that, and getting into sexual relations and all that could be very painful, you don't want to do it. So, please, husbands, please, 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 be understanding of that. Okay. So let me see here. I think I did this one. Is that they're watching? Let me see. Jack Cunning will come baby after the baby session. I don't understand. I'm sorry. I'm trying to remember. Okay. Yeah. I mean, if you mean if the baby blues come after the baby shower or something like that. Yeah. But of course, like I said, if you have like family member that need to talk, make sure you're talking to your therapist. Make sure you're talking to the pediatrician too. There's so many resources out there. Like again, I said, we can just so go back and just review a little bit what I talked about. Let me see if there's any other comments that I didn't miss here. Stanley said he's watching, and Dave just. So if any of you guys who are the therapists on here, if you want to add to anything like that, if you have any other comments or questions, you can just leave it. And sometimes I answer the questions after I'm done. So again, baby blues is like you just feel a little sluggish, a little slow, and it comes and goes. And usually it's like between 1 to 2 weeks, and it goes away. But if after that, the baby postpartum depression can last all the way up to like a year. And again, you're higher risk if you have problems like pre-existing problems before, but also that can happen out of the blue because you have this baby and you're happy, but it's a time where hormonal shift. Your all the body that the pregnancy hormones and everything kind of shifts down and go down. So if you're having these problems, please bring it up to your OBGYN. If you're going back to see your primary care doctor, please bring it up. We can also take care of that. Bring it up to the pediatrician. And if your pediatrician, primary care providers, and OBGYNs out there, they're supposed to be asking you, even if they don't ask you, please bring it up. Okay. And family and friends, please be understanding. They had this baby doesn't mean like everything is all happy and hunky-dory. They may be going through this and they may not be saying it. Just every once in a while, just say, how you doing? You want to hang out? And you may not even know, but just say it's because sometimes you never know. Just by saying these things, that person could come back months, years later and say, you know what? I was feeling so bad that day when you called me and you just said, oh, how you doing? And you just said something crazy or stupid and you made me laugh. You made me laugh. And I said, oh, okay, and they said, wow, I didn't think it was you may not have thought anything about it, but that really made that day. Okay, that may have been the day where it's like, okay, I want to, I'm going to do something to myself because it doesn't seem like anybody cares, but it may just be, just your few words here and there, just by you calling them or by stopping by or just saying, let's go do something, bring the other kids. I'll take them to the park while you get 5 minutes of sleep, 10 minutes of sleep. I would do this. You want me to run to the store and get this for you? Do you want me to get something and bring it to your house? It doesn't have to be anything major. If you want to do something major, go ahead and do something major. But sometimes just a little itty bitty things that can help that person along the way. Okay. And also for, social workers out there, please, This is the time where you also have to be involved too. Okay, so if you're working with pediatric patients or clients or mothers and people who have like these like low income or other reasons, people in the rural area too, they don't have any help that much. They don't have that much help in the rural area. Most in America, they have to drive so far to go see their family and primary care physician, and then there are like basically no mental health providers in the rural areas or certain places. So it's important that we incorporate that in family and friends. Please, if somebody's reaching out to you, please be sensitive. Please be sensitive. Please be sensitive. Please be sensitive. It's not something that we practice all the time, but please be sensitive, okay? Because again, like I said, that one thing you may say that they're already going through that could just drive them right over the edge. And you want to make sure that you have safe mom, safe babies, safe other children, safe relationships and all. Okay, because eventually these are the people that are going to go out into the community and be with your children and be our children and become productive members of society. Okay, so please, please, whatever you do, just if you can't say anything kind, don't say anything at all. But sometimes it's like you literally just have to. I have some patients where they come in and it's like I talk to them, we go through that. Sometimes it's just like touch on the shoulder, like just smile, like okay, everything will be okay, or not. And even you don't say everything will be okay. Be like, and don't promise anything. Don't say, "Oh, call me anytime. I'll be there." You're not going to be there. So don't give that. Just say, "Okay, what I can do, what I will do what I can do to help you." Don't make any big promises. You don't have to be, no hero. Nobody's asking you to be a hero. Just be a friend. Just be a listening ear. Okay? And sometimes people don't even want you to solve anything. They just need somebody to talk to. Okay? So I don't see any other comments. I don't know if I missed anything. I need to Alrighty, I've gone in. Oh my goodness, I went all the way into an hour in this. So, but anyways, I hope this show will help somebody. Please share it. Please share it. Okay, again, we don't have some of you. We don't have the same kind of friends or the same friends. So if you share it, somebody else, it could help somebody. It could save somebody's life. Somebody needs to hear this. Who really, we know somebody who needs to hear it. Even if you don't know anybody, share it anyways, and it could help somebody indirectly. Okay, so I thank you all for watching. Please give me a thumbs up. If you enjoyed the show, please share. I'm still trying to get to 1,000 followers by December. So hopefully I'll get there, but I'm hoping that you guys will help me along the way. Okay. So I'm always here Tuesday at 7 p.m. And when Friday, I do Friday chat with Abby. So if some of you want to, if you have any topics that you want me to talk about, I'm more than willing to talk about it if it's within my scope of practice. And also, if you want to talk about anything else, if somebody wants to join me on Friday to have a Friday chat, just to sit there and talk about anything that's relating to healthcare, social and services, or anything. And Friday is like a little bit more relaxed, so we can talk about anything too, as long as it's not going to do anything that's going to hurt anybody. Okay. So, but thank you all for watching. I really appreciate it. Okay. And share the show. Thank you. Thank you so much for all your love and support. So, all your family members who are not on Facebook, they can join me. They can find me on YouTube. Same name, Abby Tyler's Family. Abby Tyler Healthy Living. Okay, so thank you all for watching, and I will see you guys on Friday with Friday Chat with Abby. Okay, so good night, good luck, and happy Nurse Practitioner week to all the nurse practitioners out there. Okay, talk to you later. Bye bye. Yes, I know I see the green screen because I forgot that I'm wearing green. I'm not supposed to be wearing green when you have a green screen. So, but thank you all for watching. I really appreciate it. Goodbye. Good luck. God bless.